What if one of the most influential drugs in modern history didn't just change fertility? What if it changed the way that we think about health itself? Today, we're going to talk about how the birth control pill may have helped create a culture that increasingly looks for ways to suppress symptoms rather than understand them. That's what we're talking about today. Let's go. So today's episode is not about whether birth control is good or bad. It's not about judging women who have used it. It's not even, honestly, primarily about birth control at all. If you're wanting to learn more about birth control, I've got an entire, really it's like a masterclass. It's not what I called it, but that's basically what it is. You're welcome to go view completely for free. And the link for it is down in the show notes, or it's at go.yourbirthgodsway.com/the-truth-about-birth-control sign up. You can go learn all about birth control itself. Today's episode, while it is on some level about birth control, it's not getting into the weeds about it. What I want to talk about today is a shift in thinking that birth control caused. Because I believe one of the biggest problems in modern healthcare isn't a specific medication necessarily. It's the way that we've been taught to think about symptoms, health, and the human body. And I think that the birth control pill represents one of the most fascinating turning points in that story. Okay, so the pill, when it was first introduced, was revolutionary. Women embraced it for understandable reasons. It offered predictability, it offered control, it offered convenience. And we all know that our period is not all that convenient. It's kind of hard to predict it sometimes, and it would be nice to have these things, right? And whether you agree with birth control or not, it's hard to overstate how culturally significant the birth control pill was for those reasons. And to be fair, it provided those things to some degree if you look at it one way. We'll get into that a little bit more. But something else happened that rarely gets discussed. See, before this period, daily medications were mostly only really used by somebody who had a disease, something like diabetes or thyroid disease or epilepsy. Regularly healthy people, they didn't take medications every day. They didn't take anything every day. They just went on about their daily lives. They didn't go to the doctor. They were just healthy people living their lives. Now, with the advent of birth control and the marketing behind it, we had millions of otherwise healthy women taking a medication every single day, not because something was broken, but to override a normal biological function. Okay, you're hearing what I'm saying? A normal biological function we were altering for convenience sake. Women were told that their periods would be lighter, they would be more predictable, they'd be less painful, they'd be easier to manage. And to be fair, those things did happen, at least on the surface. But let's talk about what was actually happening physiologically. In reality, their ovulation was being suppressed. Their natural hormone fluctuations were being altered, and their cycle was essentially paused because the monthly bleed that women experience on most birth control pills is not the same thing as a normal menstrual period. It's called a withdrawal bleed. The artificial hormones are removed, which is withdrawn, and that causes this bleeding, shedding to happen. But it's not really a normal period. It subtly changed how we thought about health because this one little pill that everybody's taking every day, not everybody, that most women are taking every day, was making life easier, or so it seemed. So instead of thinking, why is this happening? Why am I having problems with my period that need to be dealt with anyway? We started learning to ask, how do we make these symptoms go away? How do we make the problem just disappear? The old question was, why are periods painful? The new question became, how can I stop the pain? What can stop the pain? Taking that a step further, the old question used to be, why is stomach acid coming up when you'd have heartburn? The new question, after birth control became a normal thing, became what can suppress it? What can make it go away? In the past, the question about anxiety used to be, why is my nervous system struggling so much? The new question, what can reduce these symptoms? What can make them go away? In the past, the old question was, why is my metabolism dysregulated when we had weight gain for unknown reasons? But now the question is, what can help me lose weight? Not how to deal with the underlying problem. The old question used to be, why can't I sleep? The new question is, what helps me sleep? We have lost that natural curiosity about what is going on in our bodies that is causing different things to happen. And so instead of looking for the cause of what we're feeling, we just want to make the thing go away. And this all stems back to the advent of birth control becoming a normal thing for most women. They were now able to make the quote problems of the monthly cycle go away without ever addressing the fact that those problems that may be coming from that cycle had a cause. We have become very good at managing symptoms and less skilled at understanding them. A quieter symptom, though, doesn't necessarily mean a healthier body. When you make things go away, that doesn't mean you got better if you didn't deal with that underlying issue. You can maybe make your blood sugar be lower by taking certain medications, but have you corrected the physiology that made your blood sugar be high to start with? Because if not, now you just have an artificially lower blood sugar. You might be able to address hormone fluctuations that aren't going like you think that they should. But did you address what caused those fluctuations to start with? Did you assess whether that was a normal part of life or was that something that needed to be fixed? Because that is where true healing lies, not in just taking a pill for it. If you're having problems with digestion, you can take a pill to make most of those problems go away. But did you deal with what was causing those digestive problems, or did you just quiet the symptom? If you're not having enough energy at the end of the day or in the middle of your day and you're worn out and you either take a bunch of caffeine or take some other supplement that's supposed to make you have more energy, that may make you feel better for a short period of time. But did you ever address why you were having these lulls in energy, which are not normal? In reality, we've lost a lot of our body literacy through this. We have lost a lot of our awareness of what's going on in our bodies because we can just silence them. We don't ever have to really learn or, understand our body. Most women don't know when they ovulate. Most women don't understand their cycle phases. Most women don't understand hunger cues. Most women don't understand energy rhythms. We have outsourced so much knowledge about our bodies that women no longer trust what they're experiencing in their day-to-day life. Their first inclination is to go to someone else to help them fix or correct or silence the problem that they're having. And yes, symptoms can be inconvenient. They can be frustrating, they can be painful, they can be disruptive, but they're also information. Things like fatigue exist for a reason. They are telling you something about your body. It could be that it's the end of the day and that you're just tired. Or it could be that you are living a lifestyle that is causing your body to be running in fight or flight day in and day out, and your body is preserving energy to get away from whatever this ongoing danger it's perceiving is. You may be having cravings, and you might think that those cravings are no big deal, but those cravings are telling you something about what's going on in your metabolism. And when you just quiet them, you never get to the root of what's causing them. There is something driving them. You may be having headaches every day or very frequently. Those headaches are coming from somewhere. Are you taking medication to make them go away? Or are you doing the work to try to figure out why you're having them so that you can correct that situation, not just medicate them? Are you having painful cycles? We talked about that a few weeks ago on the podcast. If you're having painful cycles, are you just medicating them and making them go away? Are you taking birth control, for instance, just to make them get better? Or are you looking at what is causing them? Because painful cycles are not normal. It is not normal to be hurting every single month. It's a sign that something else underlying is going on that needs to be addressed. If you just ignore that and you just medicate it, you're never actually fixing the issue. Same thing for things like digestive issues. It is not normal to have heartburn every day or to be having diarrhea every day or to be constipated all the time. These things are not normal, but you have to do the work to get to the root of what's going on with them rather than just medicate them away, or you're just silencing a signal that your body is giving you, that God put there to give you a signal to help you know something needs to change. We've become conditioned to eliminating symptoms as quickly as possible instead of becoming curious about them, and that explains a lot about what's going on in our world today with our health. And again, this all ties back to that little pill that was sold to women for freedom from all these different supposed problems. And they learned that, hey, I can take a pill for something and make it go away. See, you have one body that God gave you. And yes, this is not about living forever. Nobody's going to live forever. But that body is yours to steward while you're here. You know, we hear the word stewardship and we think about money all the time. But God gave us one body, and it is up to us to steward that body to make it the most effective in service for Him during the time that we're here and we're alive. Stewardship requires curiosity to find out why you're having the problems that you might be having rather than silencing them. Why are these things happening? What is my body asking for? What has changed that has led to whatever symptom you're experiencing? That stewardship that we really must have for this one body that we have for while we're here. It all stems back to having a healthy curiosity and not just looking to silence the signals that God put there for us to hear. Medication does have a place. Birth control, it can have a place, but in general, as you'll hear if you go listen to that class I was talking about earlier, in general, I don't know that it does have a place. I believe that in general, birth control is God's business and we should leave it to Him. But I'm not going to get deep into that again, as this is not the topic here. But I just want you to know that, there are places for some medical interventions. But symptom management and health restoration are not the same thing. Making symptoms go away is not the same thing as getting well. Those things are very different. The women who tend to heal, the women who tend to get better, the women whose symptoms tend to actually go away rather than just having them medicated away, those women ask deeper questions. They stay curious. They want to understand their body and how their body works. They take ownership of what's going on in their body. They're willing to investigate it. They're willing to think long term, not just how can I make this symptom go away the quickest, but how can I heal my body so that this symptom is never a problem again? And the women that I see make the biggest transformations are rarely looking for the quickest answer. They are looking for the truest answer, and they are looking for that long-term solution. So as you listen to this, if you are tired of managing symptoms and you're ready to understand what your body is actually trying to tell you, that is exactly the work that I do inside my functional medicine mentorship. We look beyond the symptom, beyond the diagnosis, and we ask the better questions. If that sounds like the kind of approach that you've been looking for, you can always apply for a foundation call, which is just that first call where we see what it would look like for us to work together and whether that's a good fit. You can apply for that in the show notes. It's morriswellnessservices.com/application. Or again, the link is always there in all of the show notes for you to go find, click, and just answer a few simple questions and book a time to sit down and talk with me. Perhaps the most powerful question in health isn't, what can I take for this? Perhaps it is, why is this happening in the first place? And that's what I want to help you not only learn about in your body, not from some protocol or from what the insurance says is okay, but from what your body actually needs. Not only do I do that, but then I help you implement it so that your life is transformed. No matter where you are right now, no matter how you're feeling today, you can feel well again. God made your body to heal. Sometimes it takes the right support to get you from where you are to where you want to go when your whole life the world has been telling you the wrong thing. You're learning the right thing now, and this is where transformation begins. So go sign up for that call at morriswellnessservices.com/application, and I'll see you back here next week.